Nclex RN in a flash. Do you know that you can answer 3 to 5 questions in your test by just memorizing either a word or phrase or just a sentence? These are called functional concepts. And here to tell you about functional concepts is the author of the book himself, Dr. Ray A. Gapuz.
And in these videos contained in this program, you will learn about functional concepts. What are functional concepts? Functional concepts are usable common ideas that occur in a recurrent theme in different questions on the Nclex. It can be applied to a variety of test situations in nursing exams. Let's have an example. For example, you're studying about sickle cell anemia. When you read about the topic in textbooks, it would actually take you around 5 or 10 pages to browse before you get a chance to really remember what are the most important things or concepts that you need to remember about the disease. But when you use functional concepts for sickle cell anemia, there's one single concept that you always need to remember when you're taking your test, and that is hydration. Let me give you some examples using this concept in a functional way. Remember, when you use functional concepts, you will only need to memorize one word and use that single word to answer 3 to 5 questions correctly and with confidence while taking your test. Let me prove that to you. Let's have an example. Upon admission of a 4-year-old child with sickle cell disease with vaso-occlusive crisis, the priority in nursing care is or should be A, elimination, B, nutrition, C, hydration, or D, protection. Remember, when a client has vaso-occlusive crisis, the main problem is that your blood vessels get clogged up with a thrombose formed by your sickled red blood cells that cling together and may potentially obstruct the passageway of blood. Then that makes a client more at risk for a cerebrovascular accident. So, to prevent that from happening, always remember the concept hydration. So the best answer for this question is letter C. Let's have another example. Which of the following statements by the mother whose child has sickle cell anemia would indicate a possible precipitating factor of a potential crisis? A, I see to it that my child is well cared for. B, I don't allow my child to go out of a room. C, I haven't given my child enough fluids in the last few weeks. Or D, I made him sleep earlier. Once again, remember the concept of hydration as your priority to prevent sickle cell crisis. So the answer is letter C. Not giving the child enough fluids would potentially increase the risk for the occurrence of vaso-occlusive crisis in the client. Now, how many answers did we answer so far correctly? You're right. 2 correct answers. Let's move on and add up some more. This is another example. A 5-year-old is hospitalized with vaso-occlusive sickle cell crisis and with pain in both of his lower extremities. In caring for the child during his sickle cell crisis, it is a priority for the nurse to implement measures to meet which of these goals? A, to prevent contractures. B, to prevent bleeding. C, to promote hydration. And D, to promote nutrition. What's our functional concept again for sickle cell crisis or sickle cell anemia? You're right. That's hydration. Applying that concept to this question, you actually would choose letter C. Next, we have so far answered 3 correct answers using just a single word. Isn't that amazing? Let's have some more. Let's add up one more. In the utilization of the functional concept of hydration for sickle cell anemia. A 10-year-old is admitted to the hospital with sickle cell crisis, which patient goal is a priority for this child. The child with A, participate in daily aerobic exercise program. B, take an antibiotic until the temperature is 98.6 degrees Fahrenheit. C, increase fluid intake. Or D, utilize cold compress to control pain. Remember, in vaso-occlusive crisis, the use of warm compress is preferred. Why? Because it could potentially dilate the blood vessels, preventing a potential blockage. Unlike cold compress, which will do the reverse of that. It would potentially constrict the blood vessel and aggravate blockage of the blood vessel. So for this question, remember once again, the magic word, our functional concept for sickle cell anemia is hydration. So the answer is, you're right, letter C, increased fluid intake. All in all, you were able to answer 4 questions correctly and with confidence, just using a single word.
Now, if you want to know more about functional concepts, grab a copy of the book or log on to www.gapusonline.com or gapusreview.com.